to also start streaming the webinar on YouTube as well.
Okay, we're live.
Brilliant. Hello and welcome to this Emerging Minds live stream webinar focused on how best we can support children and young people who self-harm, particularly during this lockdown and COVID-19 situation. So a warm welcome from us. So my name is Emily, and I'm going to obviously be introducing expert panelists, Dr. Faraz Mughal and also Professor Anne John shortly. But just to, over the next hour, obviously we're going to be hearing two short presentations from Anne and Faraz in turn. And then obviously there'll be a chance to raise questions. So if you're joining us on the webinar, the Zoom webinar, you can share your questions in the Q&A box, or any comments or suggestions in the chat box. If you're joining us on YouTube, please do share your questions there. We will be checking those and picking them up. This webinar will be available to watch again, so you'll be able to look back at the talks on the Mental Health YouTube channel and also on the Emerging Minds website, so that will be available. So without further ado then, I'm really pleased to welcome Professor Anne John. So Anne is a professor in public health and psychiatry at Swansea University, and Anne's research focuses on suicide and self-harm prevention and risks, protective factors and life course outcomes of children and young adults' mental health. So really warm welcome to you, Anne. If you're able to share your screen with us, that would be fantastic. Oh, so Anne, so we can't hear you at the moment. We can see your slides though. I think your microphone is on mute at the moment. Brilliant.
There we go. Start off with a technical problem. My name's Anne. I started off as a GP, and then as time went on, started working, doing predominantly research into suicide and self-harm prevention with a real focus on young people. And I'm going to start off the seminar sort of talking about understanding what self-harm is, and then Faraz will follow up with how to support young people. I'm going to really be talking about basically insights I've had following the research I've done, but also from conversations that I've had with young people over the years. I think a lot of the things that we've learned in the past in terms of working with young people who self-harm apply now, but we do find ourselves in very different times where the measures taken to curb the spread of COVID-19 have meant that some of the things that we worry about, like people in isolation and lockdown, some of the things like all the, young people are very much invested often in their supports of friends, and those almost disappeared overnight. So there are things where we might be concerned about what the impact is on self-harm, but equally there are lots of young people where school was something that made them very anxious, and they're not having to deal with that now. So I think it's really important to understand that at the moment we really don't know what the impact is going to be on self-harm. Sorry, my slide wasn't working then. So what is self-harm? So self-harm is any intentional act of self-injury or self-poisoning, irrespective of the motivation or intent. So when we're talking about motivations or intent, we are thinking about whether it's a suicidal intent or whether the motivation is to cope with feelings or to express distress. And I think it's important to understand that, because motivation and intent can change with every single time that a young person may self-harm. And often young people aren't very good at expressing what that motivation or intent is. So that's why we think of self-harm as any intentional act. So it's a behaviour, it's not a mental illness. And method and motivation changes over time, but the sorts of behaviours we're talking about, self-cutting, burning, hair pulling, interfering with wound healing, and sort of scratching at scabs. So particularly, you know, when people think about very, very young children, the behaviours look quite different, and things like scratching at scabs might be there, and overdosing. But the important thing to remember is that self-harm is an important signal of distress and crisis. You know, it means that something's not okay. And once we either see it or a young person tells us about it, there's a real opportunity for intervention. And that intervention doesn't always have to be something very medical. A conversation can make a difference. So the way we respond to young people when they talk about their self-harming behaviours, you know, because this is something that has been very stigmatised over time, that can affect. So if you respond with very non-judgmentally and calmly, it means that they'll come back either to you or someone else and have that conversation again. So our attitudes and responses are vital. If you suspect, you might suspect that your child is self-harming, or they might have told you. And if they've told you, that is really because self-harm is often a very hidden, secret behaviour. If a young person talks to you about their self-harm, whatever role you're in, they're really putting a lot of trust in you. And while I think a lot of people worry about what do I say, if I talk about it, will it make them do it more? There's no evidence that talking about self-harm makes young people self-harm more. And it's a really important way, it's really important to respond and take it seriously and not ignore it. But some of the signs, if you suspect but don't know, so, you know, at the moment, young people are very much at home. We're all spending lots more time with our children than we were before. And it's things like unexplained cuts and burns. If they're quite withdrawn, spending lots of time alone, time in the bathroom, frequently appearing with bandages. So I can remember talking to one young person a few years ago now who had gone into school with big long sleeves covering where she had cut herself, but with bandages poking out at her wrist. And one of the things she asked me was she couldn't understand why no one had asked her what they were. And that included friends and family and teachers. And I think it's sort of like, spot those signs and understand that they're there potentially because people want to be asked about them. So don't feel uncomfortable about that. So it's things like the way young people dress. There's also signs of low mood, feeling hopeless, feeling worried about the future. Now that can be difficult at the times that we're living in because there's a lot of anxiety around everything that's going on. But where you know a young person, if you're seeing a real change, have that conversation. So, self-harm in young people is, I think, surprisingly common when most people hear about how often people do the behaviour. So about 1 in 10 of all adolescents, so 15, 16-year-olds, will self-harm. So that's 3 children in a class of 30. And if you're looking at sort of young people up to 18, it's about 3 in 100. So I think it's worth understanding that a lot of young people who self-harm in the community do not seek help from services. So of those in the community, only about 1 in 8 will go on to seek help. So it really is something that's much more sort of in our schools and in our homes than people know. So you're not alone if this is something that you're grappling with within your own child. However, one of the things that people really worry about is the risk of suicide. Now, suicide is very rare. So most young people who self-harm will not go on to take their own lives. However, I'm sure many of you have heard all the headlines about, suicide is one of the biggest killer of young people around the world. Now, the reason for that is because young people do not really die from anything else. So if you're looking at deaths in middle-aged people, we can think about cardiovascular disease, cancer, respiratory disease, but for young people, it's actually a very rare outcome. But that doesn't mean that we shouldn't take it seriously. So particularly if a young person is talking about thoughts of taking their own life, we have to take it really seriously, but it's really worth understanding it's a rare outcome. And the reason that's important is back in the days when young people were in school, sometimes the panic of a reaction could lead to exclusion, which is very isolating. So I think it's important to realise it's a rare outcome, but for those young people who do take their own lives, self-harm is present in about half of them. So it's a very important behaviour to take seriously, but that fear about suicide, that's actually a really rare outcome. So the importance is to take it seriously and intervene early. And why do young people self-harm? For all sorts of reasons. And sometimes they're very ambivalent, that they don't care if they live or die. Sometimes it's a way of coping. For others, it's a way to show they're distressed. I think one of the biggest issues that is recorded across families, friends, and services is this idea that young people are attention seeking. And I think one of the ways to think about that is, well, maybe they are, but then we need to give them some attention and we need to try and understand why it is that they're self-harming. And the reasons for each individual will be different, which is why it's so important to have that conversation. So this is a slide that I often put up, and it shows all the different risk factors that make a young person vulnerable to self-harm. But I think it's really important to say in the first instance that while self-harming behaviours are commoner in certain groups, actually anyone with any background can self-harm. But I think one of the things I really wanted to highlight were the things that potentially all these measures we've taken in lockdown might be worse in terms of risk factors. So I think self-harm is much commoner in females. Low socioeconomic status, so people from more deprived communities are more likely to self-harm. And I think, given all the restrictions that we have got currently, I think that self-employed people, there are lots of people struggling with their finances at the moment and with access to benefits and with access to some of the financial safety nets that have been put in place. So I think that's a real issue at the moment. The sorts of behaviours that young people may be adopting in order to cope with being at home. So potentially alcohol misuse, online gambling, these are all risk factors. Mental disorders, so people with anxiety, things may have got a lot worse. Young people are in their own homes at the moment, which means that things that are going on at home, where people are living in quite challenging home circumstances, so where there's domestic violence, physical or sexual abuse, where parents may have mental disorders, or there's a history of family history or family experience of suicidal behaviours, or relationship discord, both not being able to see boyfriends and girlfriends, or discord between their parents who potentially aren't so used to spending time together. All of these could potentially in lockdown be worse. And I think it's really important that we look to those underlying reasons and try and address them. Bullying is a risk factor. Now, for lots of young people who aren't in school, bullying may have reduced, that sort of face-to-face traditional bullying, but the risks of online bullying may be increased. I think most young people are spending a lot more time online. And like I said, I put this up to show that although self-harm in young people is commoner in young girls, it still is there in boys. And we did a piece of work where we looked at help seeking across services, anonymous electronic health records. And one of the things we found, so anyone under 16 should, according to NICE guidance, should be admitted overnight. And we found that boys were much less likely to be admitted overnight than girls. Now, for some of them, they will have refused. But one of the things that we postulated, so we talk a lot about encouraging boys to talk more, encouraging boys to seek help more, but I think something we need to be conscious of, both as clinicians, practitioners, people who work with young people, but also as parents, is that our responses through the way we think about gender in our society may be different to young boys in distress. So I think it's important to think about having those conversations with our sons as well as our daughters. So before lockdown, one of the questions that was always coming up is self-harm increasing? And if you'd spoken to me a few years ago, I would have said, we don't know. Because a lot of the data that we were seeing were based on hospital admissions or attendance at GPs. And one of the things I thought was that potentially we've reduced some of the stigma to do with self-harm, so people could be seeking help more and admissions could be going up because we're actually sticking to NICE guidance better than we did before. But there have been community surveys recently where people have been asked in the community whether they have self-harmed. And there is evidence now that self-harm in the community has increased in young people, particularly in older adolescent females. And that's in combination with an increase in older adolescents of emotional disorders, by which I mean things like anxiety and depression. So it's the last few slides from me now. So we've done a lot of work looking at the online environment. And usually when I talk about self-harm or suicide, questions from the audience have always been very negative about the online environment. And I think it's very difficult, I think, for us as a generation who, I mean, it always surprised me. It's always, whenever I look at this, that Facebook has only existed since 2004. So many of us, as parents of older adolescents, remember a world where that wasn't like this. And I think even I have an 11-year-old, an 18-year-old, and a 24-year-old. And my 24-year-old was on Bebo. My younger kids are on TikTok and Instagram. This is a very, very rapidly changing environment, and most young people use it. I think in lockdown, these sorts of figures will have increased. A lot of young people are connecting with their friends online, but for the ones that aren't, that will be quite isolating. And where the online environment is really interesting, almost everything I do, you see a socioeconomic gradient in use. So in diagnosis of anxiety and depression, you usually see everything's usually much worse when people are struggling in poverty and deprivation. the experience of health, the experience of adversity. However, in the online environment, that doesn't exist, which makes it quite unusual. And there's very little gender difference. So I usually see gender differences in all the research that we do. There is still a small gender difference in gaming, but that's reducing over time. And most young people report having seen upsetting content or receiving rude messages online. Over time, so when I first started looking at self-harm and online, it was all chat rooms and forums. Now, a lot of the things that young people do online is image-based. And while we worry about exposure time and screen time and sleep, and the environment that young people are in now is very different, it's very hard for us as researchers to study screen time properly. So we did, so down in the bottom corner there is a piece of work I did with the University of Bristol. Unfortunately, when we asked young people in this cohort what they had been using, it was back in the day when people were on laptops. Now we know that young people access a lot of their online content on phones now. So doing that sort of rapid research, and particularly in this current environment, is something that we really need to do to get some of the answers about what the impacts are. And we looked at the impact of the internet on self-harm and suicidal behaviours. And, there were lots of negative things: normalising self-harm, glorifying it, suggesting methods of how to do it, encouraging people, spreading information, suggesting ways to hide it, competing with each other. But there were lots of positives as well, and I think sometimes that gets forgotten. So it was a coping mechanism for some young people to avoid self-harming. They found support. For many isolated young people, so those from LGBTQ communities, from ethnic minority communities, they found people like themselves. So it reduced isolation and loneliness. And isolation and loneliness in young people is really important in our current environment. And they deliver therapy, and increasingly young people communicate distress. So it's really important. Now, one of the other things that we looked at was cyberbullying. Now, one of the differences with cyberbullying that we all understand is you don't get to go home at the end of school. So now with young people at home, if they are being cyberbullied, and I haven't seen any evidence as of yet about what is happening with cyberbullying in the current COVID-19 environment. But one of the things that was different about cyberbullying and its relation to self-harm is victims of cyberbullying were more likely to self-harm, but so were perpetrators, though slightly less so. And the crossover, and by that I mean, I think traditionally we think, there's a victim and there's a perpetrator. There's a lot of crossover in those behaviours now. So people are both. And I think the big thing to keep in mind is that these are children and we should be supporting them. So it's my final slide now. So I think one of the things to understand is that most young people who self-harm will stop before they reach adulthood. But we still need to take it seriously and try and understand those underlying reasons. Oftentimes, young people will repeat the behaviour if they self-harm. For about 1 in 10, it will continue into their adult lives. Those non-judgmental conversations, asking them about what's worrying them, having those conversations in cars, or so it's not so challenging. Try not to be judgmental. Saying stop the behaviour is generally never helpful. It's really about trying to get to those underlying reasons. Ask about internet use and cyberbullying. think about distraction techniques and support networks. So for lots of young people, it's worth asking them to make a plan. What is it that triggers them? And what helps, whether that be a playlist, talking to you, contacting online support networks. I've listed some of them there. I think one of the things that's different during COVID-19 is that with everyone in the house, there's very little privacy to talk on a telephone helpline. So I think it's important to make young people aware that there are lots of services that provide web chats and text services so that they can do that more privately. And then instill that idea that things change. You know, the things that they're worried about do move on, and let them know that you're there for them. So that was as much as I was going to say. Brilliant.
Thanks so much, Anne. That's really, really helpful. It's strange we can't give you kind of a round of applause through the webinar, but that was really, really helpful. And we're getting some really interesting questions actually through the question and answer box here. So do keep your comments and questions coming. But without further ado then, I really wanted to introduce our second speaker, Dr. Faraz Mughal. And Faraz is a GP and a National Institute for Health Research in Practice Fellow at Keele University. And Faraz's research is really relevant, and it focuses on young people's mental health in primary care and self-harm in particular. So really pleased to have Faraz joining us today. If you can share your screen, Faraz, that would be brilliant. That looks great. Everyone can see that.
Hi, everyone. Thank you for joining us for a really comprehensive overview of a lot of important areas around self-harm and young people. So as said, I'll be talking about supporting young people who self-harm. And my background is I'm a researcher supported by NIHR and also a GP in the NHS. And I'll be covering some areas that are applicable to a number of different groups. So those families that struggle with self-harm in the family, those people that work with self-harm maybe in the health service and outside of the health service, and young people also who may be joining us today. So firstly, seeking help. I wanted to start off with, what does the research tell us around young people seeking help? As said by Anne, it's really important that young people are encouraged to seek help. Self-harm, from my work as a GP, but also from my research work and speaking to and interviewing young people who struggle with self-harm, it's extremely clear that it's a very challenging topic to talk about. And in terms of what helps young people to seek help, firstly and foremost, they relay that they want to be treated with respect. And this cottons onto a few of Anne's points earlier. But really, it's something that people can bear in mind if self-harm is within the household, and more so, I'm sure that people who work with young people who self-harm in their professional work, this is something that's one of the guiding principles of their work. Secondly, young people feel more at ease if they can talk to someone that they trust. So this is around building trusting relationships, and if people haven't got this at present, then it's an opportunity, if they're spending more time with the young person who's struggling with self-harm, it's an opportunity, given the current situation and context of COVID, to try to nurture that trust just through simple things in the house or on the telephone or remotely. And finally, the research tells us that young people want reassurance and assurance around confidentiality. And this is not only talking about in the healthcare consultation with someone clinically, but also with their friends, peers, and within the family too. A very common scenario is that a young person is very happy to talk about self-harm with one person in the family, but does not want another person who could be very close to them to find out about it. Could be a sibling or a different parent. So please do bear that in mind. In terms of things that hinder young people seeking help, unfortunately, the stigma around self-harm is still present. And I agree with Anne that I feel it's improving, and this may be reflected in more young people seeking help. And in the research that Anne leads, we see the presentations of self-harm to clinical services increasing, which could be a good thing. So young people have the opportunity to try to get more help. Secondly, again, confidentiality. They're concerned that they don't want their confidentiality to be broken. And one of the most important things, and Anne touched upon this also, is the initial reaction to a young person disclosing or talking about self-harm. They really, they have said in the research that negative reactions really hinder them in seeking help for self-harm. But generally, young people turn to informal supports more than formal healthcare support. So this highlights the important place that families, parents, carers have in trying to support young people who self-harm. So the research also highlights that the well-being of carers, parents and families can be severely affected if their young ones are struggling with self-harm. And in terms of the needs of families, parents and carers, this is broken down into two main areas. Firstly, support, and secondly, information. So when thinking about supporting parents and carers, the first thing that comes up in the evidence is that they really want a system-wide approach, which would involve and encompass a joined-up approach in the healthcare system primarily, which is something that I think everyone in this field is working towards. But a brief example would be improved communication between the GP practice of the young person that the family can usually go to first, and the mental health services, for example. Secondly, they really want to be able to feel listened to by people that parents speak to and reach out for help. Thirdly, they want to be able to get some advice about how to look after them, and also how parents and carers and families can seek help. And shortly, I'll be touching upon some useful resources that are evidence informed that may be useful for parents and families to look at. They really find social and peer support to be really important. It's always useful to talk to other people who have gone through similar experiences, and this is really important with families. And if you know someone, or it may be an idea to reach out to close friends just to share your concerns, and you never know, you might find out that other people are going through similar situations too. And finally, parents and carers have said that they want to learn new skills to improve relationships and communication within the family and with their young people. So in terms of the second area of need for families, parents and carers, they highlight the importance of information. So this includes helpful strategies and treatment options that they can perhaps talk about and share with young people, practical advice, and also a diversity in information sources, and we'll touch upon this shortly. So moving from parents, carers and families to what do young people, what are they after? What were they like, young people who struggle with self-harm? Firstly, again, just to emphasize, it's it's quite an easy thing to do. It's very slip of the tongue, or something that shocks you if you weren't expecting a young person that you may know or work with to disclose self-harm. But do really try to take a minute to try and pause and think about a useful response to give back to the young person, because often young people do say and tell us that it's the first response to help seeking that's really important for them. If it's a bad experience for the young person, then that really does affect future help seeking. So trying to have an open conversation as best as possible in the current circumstances is something that we should try to implement. Secondly, young people say that they want support in accessing services, both formally and informally. So not only those in the NHS, for example, but those really important services that fall outside of the NHS, such as community services, self-harm charities, support work, and the list can go on. They again want to be spoken to with respect and have their privacy maintained. And this falls under certain boundaries. And of course, now sticking and adhering to boundary and climate where the majority of people are in limited, restricted areas is hard. But maybe thinking about ways to try to maintain that can be useful. And finally, but maybe equally as important as all of the other points, young people say that from their families, parents and carers, they want time, attention, support and care. And this coronavirus pandemic global issue at this present time, impacting on so many people's lives. However, one positive that may come out of it for the people that haven't been affected by the illness is the opportunity to have dedicated time in the family as best as possible, maybe a lot more than they wouldn't have in the past. And that could be something to think about, to try to make use of the time with young people, building those relationships and trying to build that trusting relationship. So now moving on to what can GPs do? This is around my own personal practice and what I know about general practice and GPs and self-harm, but also it can be transferable and applicable to other clinicians outside of general practice and therapists and people that generally see young people face-to-face or one-to-one, now remotely. And it does also apply to remote consultations, either video or telephone call. I've chosen 5 key things here, and these are evidence informed generally. Firstly, again, can't emphasize this enough, those open, non-judgmental questions are really important for those people in a trusting position, for example, if they're in the healthcare system, to really allow the young person to open up and allow them to talk a little bit about their self-harm, to understand the context of self-harm. A lot of us in our professional work, especially in the NHS, are pushed and pressured on time, but it's something to just bear in mind that the self-harm is the most serious risk for death by suicide. So even if we are running very late or we're inundated with lots of requests in our work environment, just to try and give young people a little bit more time where possible. Secondly, I did a bit of research recently looking at all the global evidence, and I found that the involvement of parents and carers and families can help the GP consultation with a young person who struggles with self-harm. So think about involving them where applicable and where consent is being given by the young person. Follow-up is another really important area. Clinical guidelines for general practice touch on this very briefly. And I know people practice in different ways, but it only takes a few moments just to think about dropping a young person a brief telephone call, maybe 1 to 2 weeks after they've talked to you about self-harm. And again, it's about validating the self-harm, and also about realizing that yes, self-harm can come and go in terms of self-harm behavior, but we still unfortunately have a lot of young people who repeat self-harm. And in general practice, 1 in 5 young people in the year after they see their GP would unfortunately self-harm again. So thinking about the environment, everyone's environment is going to be very, very, very different at this moment in time. But it's important to ask about what the environment like is for that young person at that time of speaking to them, and think about if there are any concerns for their mental health and physical health in that environment, and therefore safeguarding is a really important area to think about and to explore with that young person. And also, people speaking to young people in a professional in their professional work need to be aware of what services are available in their locality, also online services, and there isn't an exhaustive list of self-harm online services, but we'll touch upon a few of them shortly. So last few slides now. Some practical suggestions during this very difficult time. And I'm sure a lot of these 5 points are not new for the majority of people here, but it's always useful just to recap, and they may serve as useful reminders for all of us. Firstly, when a young person is feeling distressed, upset, and we know that significant psychological distress is a significant precursor to self-harm. It's important to discuss with the young person, or if you're the young person yourself, try to find distraction techniques. Now, you may have explored all of them at home. You may have run out of anything new. This might be the time then to maybe speak to people and try to find new ways to try to cope with thoughts and feelings. Secondly, trying to engage with family members, and everyone's now using more virtual engagement, and that's something to try to bear in mind. Routine can help well-being and emotional health, and that's something across all mental health problems, but we do know there's a little bit of work around sleep, and sleeping poorly can affect self-harm thoughts and suicidal thoughts. So trying to establish a good routine in the day can help with that. For parents, carers and families looking after people who self-harm, think about ways to look after yourself also. It can be a very distressing time. It can be draining, and it can impact the burden can be quite heavy on people who engage with young people and try to support them. And self-help ideas, such as there are a lot of apps out there. I'm not sure, I don't think any of them which are freely available are informed and have been evaluated through research, but they may still be useful to refer to. There are several fantastic self-harm charities across the country, Harmless being one of them, charities around the Bristol area, and then if you've tried those resources and those options, then it's always important to reach out to your GP, who is your first port of call, and one-on-one services if the GP practice is unavailable. In terms of young people who feel like they've gathered enough, they've got the courage now to talk about self-harm, a useful tip that I've come across in the past is to try to maybe write down what you want to say to someone, whether that's someone in the family or someone in the healthcare service. If you find it difficult verbalizing it, then maybe writing it down, email or paper, something similar, that may help also. So in terms of support services, the website called Couth, and that's available across different CCGs, which for people that aren't aware of that term, it's the clinical commissioning group that fund the majority of NHS services in that area. I guess the first thing to do is just to put it into Google and try to see if you can access it free of charge. Also, people's GPs can give them access if they've got the funding to do so. Everyone generally has heard about Samaritans, but that can be accessed telephone or over email. Young Minds have really good resources on self-harm that people can read, not only for young people, but for parents, carers and families. Harmless is just one self-harm charity that I'm aware of. I'm sure there are lots more who may be able to support families and also young people too. And Childline, lastly. The image of the Coping with Self-Harm, a guide for parents and carers. This is a fantastic guide. I saw a few questions earlier about what resources there are for families, parents and carers. And this guide is evidence informed from a large research project that interviewed several parents, carers and family members of young people. So it's really worth having a look at that, and just typing that guide into Google will get the link from Oxford University. So I hope that's been useful, and that's the end from me.
Brilliant. Thanks, Faraz. Are you okay to yeah, that's brilliant. Oh, yep. Thank you very much for that. So we are due to finish at 12, so we haven't got very long, but I think Anne and Faraz's talks were extremely comprehensive. If you haven't already and you're joining us on the Zoom webinar, I really encourage you to have a look at the chat box and also the Q&A box. So for those joining us on YouTube, there's quite a few suggestions there. References to papers and also references to useful resources online. So all the links that Faraz and Anne have mentioned, and also the ones that other participants have mentioned here, we'll make sure we share those on the Emerging Minds website. If you're joining us through the webinar, we'll send you an email with a link to that. But yes, there's a lot of really great discussion going in that chat box and on the Q&A box with people signposting each other. So that's really helpful. So I guess we haven't got long for questions, but I wanted to quickly just signpost you all to some other information which might be quite helpful, and then we're going to return to Faraz and Anne just for a final kind of wrap up. So I'm going to quickly share my screen with you now. There's lots of great feedback coming through on the chat box here on the Zoom webinar as well. So yeah, do let us know what you're going to take away from the session, or any other kind of comments. I'm quickly going to share my screen with you now. So yeah, so really I wanted just to flag from the Emerging Minds point of view that there are some other recordings from other webinars that we've done which you might find helpful, and I really recommend you have a look at these. So we've had 4 other webinars very similar to this, with researchers telling us what research can tell us about supporting children and young people. So you can see the topics there, but one's about supporting children with their worries, supporting autistic children and young people. So you might find that helpful. Please do stay in touch with Emerging Minds. We can keep you posted to similar events such as this. Anyone can join that's interested in research and what it can tell us. Please also, if you are a parent or carer or you work with parents and carers, please do also consider taking part in our coast-based study. So we are trying to track and explore and understand how families are coping in the current situation. So the coast-based study is interested in hearing from parents and carers of school-age children in the UK. And we also have a kind of parallel study, which is called Co-Spice, and that's interested in hearing from parents and carers of preschool-age children. So that's those children that are aged 2 to 4. And I'll send you all these links. We've also got some really interesting resources on the website as well, which is particularly around supporting children and young people with their worries and anxiety. That's translated into 15 different languages now as well. So that's a really useful resource if you're working with speakers of other languages. And yes, so keep in touch with us. Let us know what other topics you would find useful in this series. We're always really, really keen to know. Right, so just stop sharing my screen now. So before we wrap up then, I'm just really interested just to go back really to Faraz and Anne. I think obviously there's quite a few questions that have come up from people that we haven't really had a chance to have a really big discussion on. But is there anything you want, any kind of final comments that you'd like to make? Perhaps I'll go to you, Anne, first. Is there anything you'd be keen for people to take away from today?
I guess the main message from me is that we need to take self-harm seriously, and we need to have those sorts of non-judgmental conversations, but to understand it's a behaviour and it's the underlying reasons that we need to address.
Yeah, thank you. Thanks, Anne. What about you, Faraz? Anything to...
Yeah, I'll just think about it from a clinical point of view. For clinicians and those non-clinicians who are working with a young person one-to-one, of course, this is a very unusual time for everyone, but just bearing in mind that keeping in touch as much as possible with the young person, it may be their only support service at this present time. So where appropriate, even if it's by email or if it's not always on the telephone or via video call, where you can, do think about that and just checking in on that young person. And also for those people working with young people all the time, just think about self-care and self-help. It's a very difficult topic to talk about and work with for some people also. So please do bear that in mind.
Brilliant. Okay, well, thank you very much, everyone. So as I say, you know, there's obviously so much more we could discuss and talk about today. And I'm sorry we didn't have so much time as we might have hoped for the questions, but I'm really delighted with the discussion that's been going on Twitter, also in the chat box now. So if you haven't had a chance to look at the chat box, do have a look now, or the Q&A box. And as I say, we'll be sending a follow-up email to everyone who registered for the Zoom webinar. That will include all the various links and resources we've shared. But if you're joining us through Twitter or YouTube, then don't worry, just go to the Emerging Minds website, and we'll share all the different resources, and that you can listen back to the recordings there as well. But yeah, so thanks so much. It's lovely to see in the chat box here on the Zoom webinar, people just telling us kind of final thoughts on their mind, and things they're taking away. But thank you so much for taking the time to join us. We look forward to kind of keeping the discussion going. Thank you very much for joining us. And thank you very much. I forgot to Anne and Faraz, I'm so sorry, I forgot to thank you. Thank you very much for joining us and sharing so much of your expertise with us today. It's been brilliant. Too busy.
Thanks for organising, and thank you for health as well.
I was too busy thanking our participants. I forgot to thank you guys. But yes, oh goodness, there's still really great resources and references coming here in the chat box. So we will look through all of that after today, and make sure we pull out all the key tips and useful resources there. Thanks very much for joining us. Thank you. Thanks very much.